everyone, welcome back to our channel Dentistry of Two Minds. We have already started exploring the fascinating chapter on Introduction to Dental Anatomy. If you have not watched the first lecture yet, be sure to check it out. In that session, we had covered the types of dentition, arrangement in dental arches, and classes and types of teeth present in human dentition. In today's lecture, I will dive into the topics, the traits of tooth, dental formulas, stages of dentition in humans, and the parts and structure of tooth. So let's get started. First we'll start with the traits categories of tooth. While describing the anatomy of the tooth, its morphologic characteristics are compared with that of the other tooth so that any similarities and differences can be noted. A trait is a distinguishing characteristic, quality or attribute. The tooth trait can be categorized as follows: set trait, arch trait, class trait, and type trait. Set trait or dentition trait distinguish the teeth in the primary dentition from the permanent dentition. Example: primary teeth have bulbous crowns and constricted necks. Permanent teeth are darker in color, whereas the primary teeth are more whitish. Arch trait. Arch trait distinguish maxillary from mandibular teeth. Example: maxillary molars have 3 roots, while the mandibular molars have 2 roots. Class trait. It distinguishes the 4 classes of teeth, namely incisors, canines, premolars, and molars. For example, incisors have straight incisor ridges, efficient for cutting. Canines have single pointed cusps for pursing food, and premolars have 2 or 3 cusps for shearing and grinding, and the molars have 3 to 5 flattened cusps, ideal for crushing food. Next is type trait. It differentiates teeth within one class. Example: differences between the central and lateral incisors, differences between the first and second premolars, or difference between the first, second and third molars. Maxillary central incisor has straight incisor ridge, while that of lateral incisors is curved with rounded incisor angles. Coming towards the dental formula in humans. The number and type of tooth present in the dentition can be expressed in the form of dental formula. The dental formula are used to differentiate the teeth dentitions from that of the other species. The dental formula is different for primary and permanent dentition. Since the left and the right halves of the dental arches are exact mirror images, the dental formula include the teeth present in one side of the mouth only. The different classes of the teeth are represented by the first letter in their name. Example: I for incisor, C for canines, P for premolars, and M for molars. Each such letters is followed by horizontal line. The number above the horizontal line represents such type of teeth present in maxillary arch, while the number below the line represent such type of teeth present in mandibular arch. Dental formula for primary or deciduous dentition. The primary dentition has the following dental formula, expressed as 2:1:2. That is, each quadrant in primary dentition have 5 teeth. Beginning from the midline, they are the central incisor, the lateral incisor, the canine, and the first molar, and then the second molar. There are 10 teeth on each side of the midline, and thus adding to the total of 20 teeth in deciduous dentition. Dental formula for permanent dentition. In permanent dentition, the premolars are present in addition to incisors, canine, and molars. The number of molar teeth is increased to 3. The dental formula for permanent dentition is as follows. It expressed as 2:1:2:3. The permanent dentition consists of 32 teeth, 16 in each jaw and 8 in each quadrant. The teeth present in each quadrant from the midline are central and lateral incisor, canine, first and second premolar, followed by first, second and third molar. Coming towards the stages of dentition in humans, traditionally 3 stages or periods of dentition are recognized in humans. They are the deciduous dentition period, mixed period and the permanent dentition period. Talking about the deciduous dentition period, the deciduous dentition stage begins from the time of the eruption of the first primary tooth, usually the mandibular central incisor, at around 6 months of the age. It lasts until the emergence of the first permanent tooth around 6 years of age. During this period, there are only deciduous teeth present in the oral cavity. Oral motor behavior and speech are established during this period. Next is mixed or transitional period. Mixed dentition stage is a transition period when primary teeth are exfoliated in sequential manner, followed by the eruption of their permanent successors. This stage lasts from 6 to 12 years of the age. Both primary and permanent teeth are present during this period. The mixed dentition period begins with the eruption of permanent first molar and mandibular central incisors. It is completed when the last primary tooth is shed. During this period, the primary incisors are replaced by the permanent incisors, the primary canines by the permanent canines, the primary molars by the permanent premolars. It has to be noted that successors of the primary molars are the permanent premolars, not the permanent molars. The significant changes in occlusion during the mixed dentition period due to significant growth of jaws and replacement of 20 primary teeth by their permanent successors. Next is permanent dentition period. It is well established by about 13 years of the age with the eruption of all the permanent teeth except the third molar that erupt late in the life around 18 to 21 years. The permanent molars, 6 in each jaw, 3 in each quadrant, have no deciduous predecessors. In other words, the permanent molars do not replace any primary teeth but erupt distal to the last primary teeth on the dental arch. They extend the dental arches at the back of the mouth as the jaw increase in size with growth. Coming towards the parts of tooth, any tooth has 2 main parts, the crown and the root. The crown is a portion of the tooth that projects above the gum line into the oral cavity, while the root is that portion of the tooth that is embedded in the jawbone and encourage the tooth. The crown and root portions are joined at the neck or cervical area. The junction between the crown and the root portion is marked by a distinct line, the cervical line. Anatomical crown is defined as the part of the tooth that is covered by enamel, while the anatomical root is that portion of the tooth that is covered by cementum. The cervical line that signifies the cemento-enamel junction separates the anatomical crown from anatomical root. The cervical line can be clearly observed on an extracted tooth. This relation does not change with age. Clinical crown is a part of tooth that is visible in the oral cavity. Clinical crown is limited by the gingival margin or gums. It may be smaller or larger than the anatomical crown. The clinical crown is smaller than the anatomical crown in newly erupted tooth, whereas the cervical part of the anatomical crown is still covered by gingiva. On the other hand, clinical crown may become longer with age as some of the anatomical root get exposed to the oral cavity due to gingival recession. Clinical root is that portion of the tooth which is under gingiva and it not exposed to the oral cavity. It is longer than the anatomical root or newly erupted teeth, as the unexposed part of the crown is considered to be the part of the clinical root. In older person with considerable recession of gingiva, the clinical root is shorter than the anatomical root, as the portion of the root that is exposed to the oral cavity is considered to be the part of the clinical crown. Now let's talk about the structure of tooth. The tooth is composed of three hard mineralized tissue: the enamel, the dentin and the cementum, and one of the soft tissue component, the pulp. Enamel is ectodermal in origin, while the all other tissue of the tooth are mesodermal in origin. Enamel. It is the hardest substance in the human body, consists of more than 96% of inorganic material. It forms a protective covering over the crown portion of the tooth. Enamel is not present in the root portion. Although hard in nature, enamel is extremely brittle due to its high mineral content. Unlike dentin, cementum or bone, the enamel does not show a continuous formation throughout the life. Once the crown formation is complete, no more enamel is deposited. The enamel developed from the enamel organ and it is ectodermal in origin. Dentin. It forms the major bulk of the tooth. It is present in both crown and root portions. It is not normally exposed on the surface of the tooth unless the tooth is badly worn out. Dentin is more resilient owing to its collagenous organic content, supports the enamel and compensates for its brittleness. It developed from the dental papilla and it is mesodermal in origin. Cementum. It is a hard avascular tissue that covers the root of the teeth. It gives attachment to the periodontal ligament that binds to the tooth of the alveolar bone. Cementum develops from the dental sac and it is mesodermal in origin. Pulp. Dental pulp is a specialized connective tissue that carries blood and nerve supply to the tooth. It is housed in the pulp cavity present at the core of the tooth. The pulp is well protected by a rigid dentin walls. The portion of the pulp in the crown is called the pulp chamber and the portion of the pulp in the root is called the pulp or root canal. The pulp develops from the dental papilla and it is mesodermal in origin. Many functions are attributed to the pulp including formative, sensory and defensive in function. That's all for the today's lecture. In the next lecture, we will discuss basic terminologies, anatomical landmarks on tooth surfaces and root, and the arbitrary division of the crown and root into thirds in dental anatomy. Thank you. See you in the next session.